I was still actively using when I found out that I was pregnant for the second time. And that was really scary. I didn't know what I was gonna do. I didn't want my baby to be affected, so I told my doctor, which was hard because I didn't want to get into trouble. I told her and she got me help, and that was kind of the beginning of how everything started to change.
As midwives, we provide universal screening for all of our pregnant women to identify at-risk women for use of opioids and women who are currently using. Once identified, these women are referred to our perinatal navigator for exploration of services and their needs on an individual basis.
My role in this is that providers refer patients, pregnant women, after they've screened positive from a screening tool that we use in offices that we've set up and educated our providers to use. So that is usually the 4 Ps or 5 Ps that we're using in our clinics. Once the referral is made to me, then the patients are then incorporated into a medication-assisted treatment clinic. So we here at Centra provide an outpatient therapy clinic for pregnant women. So I work very closely with these moms to provide care coordination when they're in treatment for their opioid use disorder.
I talk to them about what to expect when they come to L&D and mother-baby, what my role is as a social worker. I let them know what the state laws are as far as in the state of Virginia. We have to report all moms who are in treatment to Child Protective Services. I prepare them for that.
They see me for outpatient individual counseling and group therapy. I do assessments to see if they're depressed, because we have a lot of postpartum depression and anxiety and different mental health things, so I assess for that and then I treat them.
I work very closely with the perinatal navigator. I take referrals for the opioid-dependent pregnant women. We have multiple levels of care that we can provide these women with. We have the inpatient dual diagnosis unit where we can detox them, we can stabilize them on medications and address both their mental health and addiction needs. We also have the outpatient medication-assisted treatment clinic where we can serve them. During delivery, it's a coordinated effort between the perinatal navigator, our pharmacy department, the neonatal team, and the mom and her family to make sure that all the needs are met for both mom and baby and that we have the healthiest outcome possible.
We want to make sure that we are doing the best that we can to make sure these moms are comfortable throughout their delivery and even in the postpartum phase. We've kind of created bundles to help make sure that we have protocols set in place to treat these moms for pain management.
There's nothing like it. Tearing up just thinking about it. It was beautiful just seeing that she was healthy, and she's been such a joy. If you get the help that you need, then you can have a healthy baby, and your baby can be just like everyone else's baby, and that's what happened with me.
Our moms with substance use room in with their babies, the mother baby. So what that's changed for us is our nurses work more closely with moms. Moms are part of the treatment. They're very engaged. They are what helps their babies get better.
NICU has a twofold purpose in supporting the mom and baby. After discharge from the mother-baby unit, we offer rooming in our NICU for the mother and baby to support them throughout the discharge process. Another purpose we have is to support the babies that do develop withdrawing symptoms with pharmacological treatment and intervention. In addition to supporting the pharmacological interventions, we also support the mom and baby in preparing them for discharge to home with creating a quiet, soothing environment.
I think back in 2015, we continued to see an alarming increase in trends in babies that were being admitted to our neonatal unit. And it really sparked a vision of how can we fix this. The bundles and the evidence base have just been our guiding light, if you will, of ways to help us frame what those programs need to look like.
When these women come in, it's pretty much like they're being wrapped in a cocoon of support, of caring, and everybody's there just to help them meet their goals, and we're there for them, and it's really a great thing.
I would be dead or in prison. I'm 100% sure. There's no doubt in my mind. This program absolutely saved my life. It gave my children, a good mother, which is something I wasn't sure I'd ever be able to be again.